Hey, good morning, everybody. It's Peter Catalano with Catalano Financial and Insurance Services. And you know what? I love doing these interviews. So I call this the interview. And today we've got David Deal with us. And as part of any sound financial plan, you need to have your insurances in place. And one of them is health insurance. And health insurance comes in a lot of different forms. You got the marketplace, you got employer plans, you got individual plans. And David's here to talk to us more about the individual plans, less about the marketplace or the employer plans, because his market is helping people with the individual plans. We have the great resignation going on. A lot of people changing jobs, still want to have coverage. A lot of people like me. I'm an independent solo practitioner. I'm not part of a group plan, or at least I haven't created one with my entity, and I'm not, interested in the marketplace plan. So David's been educating me on how to handle health insurance for me, my spouse, my kids. And I thought it'd be great that during this open enrollment period for you all to hear a bit from an expert on health insurance. You know how I do it. I'm not an expert in all subjects, so I bring in the experts to help advise me and help my clientele. So David, welcome. Thank you for being here today.
Good morning, Peter. Thank you very much.
Oh, gosh, more than my pleasure. I love all the education that you bring to me, and hopefully we can bring it in the next 10, 15 minutes here to help people make a healthy choice in their health insurance coverage. So David, before we get started, give us a minute or two about yourself. Who are you? And you're here in Houston, and let people know.
Thanks, Peter. Yeah, born downtown, native Houstonian, lived here my entire life. I've been in a sales consultative role, my entire career, and family, married, grown adult kids, and play disc golf once a week. Love motorsports, follow NHRA drag racing and the Formula One racing, and surfing.
Oh, wow. Well, you really get out. You're very active. I love it. Well, David, let's get into this health insurance topic here. So health insurance, I tell you, I've been dealing with health insurance all my professional career, the 30 years there, and it still baffles me to this day how we have a distribution system the way we have it. So talk to us about your particular offerings out there. I know you're not a fan of the marketplace, correct? Or at least you're not working with people who qualify for the marketplace. Is that correct?
No, actually, I do work with people who qualify for the marketplace. You're exactly you're on target there, and that one of the unique products we have is one that people have to qualify for based on their health, and they're typically people who are paying for all of their premiums. But if I can't help them, then I do help them get a marketplace plan that's affordable if they need that, and if they do have medical conditions, want to make sure that those get covered. Marketplace plan is the place to go for that.
So let's break that down a little bit if I'm hearing you correctly. So first step, are you healthy? And what I'm hearing you say is you go through the underwriting process, the health underwriting process, to make sure that the health insurance carrier is taking on people who they consider are good risk, right?
Yes, it's not unlike you, Peter, with your life insurance. You're having a conversation with people. What's your situation? What's the money situation? What do you want to plan for? What do you have to? What resources do you have on hand to put in place? And then next is what's going on with your health.
So you take an application, or are you able to ascertain just in the conversation before even getting the application process? Do you kind of get a feel for somebody and, hey, I don't know if this carrier will take you, you should be on marketplace, or do you have to apply first and find out you're denied to get qualified for marketplace? Help me understand that. What's the process in that regard?
Yeah, there's 3 steps. First one is just the conversation. Mm-hmm. In the conversation, I can decide which way to go, and I don't even mention a plan that they can't get if I don't think that they can get it. If there's some question about some things they got going on, I've got an underwriting guide. We actually look up the specific situation going on, and I can tell right then and there whether it's going to be the standard issue or decline.
Interesting. So what is somebody like me? Give me an idea of the kind of the conversation that you need to have to kind of, what kind of questions are you asking? I guess we should go there.
Yeah. Well, first of all, what's your situation? Why are you asking for health coverage? Let's say that you've left somewhere and you've just started your financial planning or insurance gig, and you need coverage yourself. And do you want to cover yourself or yourself and your family?
Okay, so you start there.
Yeah.
and then determine. So let's say, yeah, I'm independent, don't have coverage through an employer, of course, and now how do you ascertain? Give me an idea of some of the questions about the health side. How do you kind of ascertain if I'm qualified for independent versus marketplace?
Height, weight. Do you smoke? Do you have high blood pressure? Last time you're in the hospital? Are you taking any medications currently? Do you have any diagnosis? That's it right there.
So those are the big questions right there. So based on the answers to those questions, you can kind of determine which direction a person might qualify
Very
for. Now,
clearly.
now help me understand premium wise. Isn't the marketplace cheaper?
The only time the marketplace is cheaper is if there's a subsidy. If the taxpayers are paying part of the insurance premium.
So can you give us?
I won't say only. Generally speaking, across the board, yeah, that's when people say I can get a plan cheaper than that on the marketplace. It's because they qualify for a subsidy that the taxpayers are paying.
So how does that work? What do you mean qualify for a subsidy?
Well, so the Affordable Care Act makes healthcare affordable through Obamacare or the marketplace. And the way they make it affordable is based on income, family status, number of people in the household. There's some formula that they come up with to determine whether you qualify for assistance. And so a single
Interesting.
mom who has 3 kids, let's say she's making $40,000, she can get free coverage.
Oh, wow. Now that's not a Medicaid coverage. That's through the marketplace, the Obamacare Affordable Care Act coverage, right?
Yes, yes.
Okay. So most of the people that I'm working with are married kids. Your typical. They're independent practitioners. They may or may not qualify for a subsidy, depending on how their accountant runs their numbers, I guess. So how would somebody work with what you have to offer, assuming they pass all the health questions, right?
Yeah, well, for sure. We take. I can tell you, we take them. I do a screen share. I don't speak to people. The verbal conversation happens on the phone. It's about 5 minutes. Then we schedule a screen share, and they're looking at details. So they're not just listening to me talk. I'm showing them actual plans, actual features, benefits, showing them how the plans pay. I take them to the marketplace. We enter their data. It shows exactly what they'd be paying for specific plans. On the private PPO type plans, there's a couple more steps in the process, which is the questions I just asked you, and then we get into the details if those are not cut and dry, and then there is an application and an underwriting process to see if
How
they
long
can.
does that normally take? What's the
It could
underwriting
be as
process?
quick as just a few hours, or it could take 2 weeks if there's questions and we need to order doctor records.
Got it. Now, a lot of my clientele, David, are traveling, right? They're comfortable, let's say it that way, and traveling either within the states, and many of them are traveling out of the country, COVID allowing, right? And health insurance is always an issue that comes up. How do your plans handle this kind of a traveling situation?
That's a great question, Peter. Yeah, one of the most difficult challenges for me, for really anyone, to determine the value of health coverage. Um, well, I found, frankly, it comes when they find out what's not covered, when they have a problem, when they're out of state on a ski trip and they injure themselves, and the plan that they have in their resident state, which is different than the state they're skiing, um, doesn't pay for medical services out of state unless they're life
So,
threatening. They've got to
so
stabilize them and get them back to the state of residence for the HMO plan.
So HMO is an in network, and in network meaning you got to deal with the folks that the insurance company have contracted with in a particular region in that network, right? Not to repeat it. And so if you're out of network, you may not get the kind of services that you would have in network. Now, are yours plans HMOs?
Yes, they're HMOs, and that's and plans where you can either be in network or get a network a discount uh, just about anywhere. Nearly everyone who takes insurance will take the this network.
So HMO, if I understand it correctly, David, is local. I understand the other version of PPO allows us to expand beyond a local network. So are you HMO plan or PPO plan?
It's a PPO plan.
You're a PPO plan, right? That you guys recommend. Okay. So I'm skiing. I got the family. I'm in Colorado. I'm based in Texas. One of my kids breaks a leg. I'm not on the group plan that may or may not have coverage outside of my state. With you, I'd be on a PPO plan that would allow me to work with doctors or hospitals or whoever I need to in that particular state. Correct? Am I saying that
Wherever you
correctly?
are. Yes.
Okay. What about international? How does that work?
Yeah, in some circumstances, if you have an accident or become ill out of the country, there's benefits in two of these plans to get you back in the country for treatment. We'll even fly your family back in if y'all are on a
Now,
family
will they
vacation.
take care of the immediate issue in that country? Something happens unforeseen and I'm going to bleed out by the time they get me on a helicopter or a plane and get back here. I mean, am I just
Yeah,
out of pocket in that
that's a
country or?
that's a very specific question. I don't want to answer that one right here. But
Okay,
basically, if you become ill and you're able, you're not dying, you become ill, and if you're dying, then you need to get services right there
right.
immediately to take care. And then once you're stabilized, get you back in the country for the rest of the treatment.
Got it. Got it. So I'm thinking somebody's in a foreign country and there's a unfortunate accident with a bug. They get a bug bite that's terrible, or
Right.
something,
That's a
or
great example.
bad food, or something. They're certainly not
Right.
going to a country that riots are occurring and they're
Right.
getting in the middle of gunfire, of course. By the way, do you restrict where coverage could be based on the country they go to? That kind of makes sense to me. Like, if you're going into a war-torn country, don't know if we're going to cover you. You're taking the own risk there, buddy. But if you're going to, Italy, Spain, Europe, Germany, you're pretty safe. Is that how
Yeah,
it?
I wish I could talk about what's included worldwide, but really we should, if you're planning a trip, we should talk and find out some specific details about what's going on, and what if you get a virus over there, or, something like that.
I've always
But
good
yeah,
choice,
so
right?
the
When
the
COVID
the, the
happens
peace of
over there.
mind here is that there's benefits in the plan to get you and your family back into this country to receive medical services.
Perfect. And then
Yeah.
for those people who aren't really traveling out of the country, they're traveling state to state, or they're just hanging out here in the Houston marketplace, or wherever you're licensed to work with them, whatever state you're licensed to work with them. This PPO you're working with is nationwide, I'm presuming.
Yes. Yes, sir.
Any states that it doesn't cover in?
So we operate and licensed in 33 states. However, it doesn't matter where you are when the event occurs.
Okay, so if
Yeah.
I'm in one of the states that, as long as there's a contract relationship with the insurance company and some medical professionals in that state, we're good to go. And
You
you're
have to
probably the
purchase
one of the
it.
most expansive.
Your residence must be in the state that we're licensed to do business, and then it doesn't matter where you are when you become ill or have an accident.
Fantastic. And you're covering the whole family, right? You're covering me, my spouse, my kids as an option if I choose.
Yes.
And what kind of deductibles and out of pockets? You have a big range of it. Real quick, is it $100? Is it $1,000 of deductible? What kind of risk are we taking on ourselves?
Yeah, you can look at from $7,000 a year out of pocket maximum up to like 15.
Got it. So pretty good range and pretty good options. So look, we're running out of time. I know I went down this European trip real quick. David, how do people get a hold of you?
281-723-3153.
And
That's
just call
my
you and
business
have
line.
a.
Just give me a call direct. Yeah, or you can go to my um, LinkedIn and click on the calendar there, get a Calendly appointment, and we'll visit. Usually we start with a
Fantastic.
phone call. Even if you schedule an appointment, we're going to get on the phone and have a chat for a few minutes.
So first step, phone call, have that call, then determine what your needs are, and then go from there. Well, David, we're out of time on this 15-minute here. Thank you for taking this time with me today. Love to have you back and chat some more. Would that work?
Yeah, I appreciate you, Peter. Let's do the same.
Pleasure's mine. You have yourself a great day, y'all.